introduce the members of our panel. We have first Walt Chappell, who is a candidate for the state school board, who is employed in the College of Medicine at Iowa State University. University of Iowa, I can never get them straight. We have Ron Honeyhockey, MD, who is from the Bright Spot for Health, who tells me he's a native Kansan KU Medical School graduate. And we will hear then at the end from Jane Burns, who is a registered dietitian who has extensive experience with nursing homes, school nutrition, and hospitals. The format for today's roundtable will be that each participant speaks for 20 minutes or so. No, actually, 20 minutes. I will go to that. Yes, there's a clock on the back wall. Then we will move on. So an hour's worth of presentations between the three presenters. If you need to use the restroom, get a drink by all means. And then after the presentations, we will have, what does that give us? That gives us about a half an hour's worth of question time and discussion time. Capiche? So is everybody comfortable with the format? Well, I'd like to invite Walt Chappell up here. And would you like me to pass these out, Walt?
Please.
Okay. And again, I would like to just urge you all to sign up on the Democracy for America sign-up sheet there, and take some of the handouts as well, so that we can.
One goes up on it.
And also for our presenters, we have an easel board here for you to use.
Wow. Everybody's prepared.
Yeah, we're very impressed here with the libraries accommodating us.
Well, I see some familiar faces and some new faces, so it's good to have a chance to visit with people. And this particular discussion this evening is about healthcare, something we all have a very dear and concerning interest in. Our own bodies are pretty important to most of us. Probably till the time we pass on to another life, right? So, yeah, we have to take personal interest in what's going on and also be able to make some choices for ourselves. I was interested, my wife pointed this out to me as I was coming today. We just got in the mail the Heart magazine. On the front cover it says, why healthcare costs so much and what you can do to reduce the cost. One of the things that we wanted to do tonight was to try to talk about how to bring down the cost of healthcare and make it more accessible. Many of us, of course, have heard all the proposals about healthcare reform that say, well, taxpayers should pick up more of the tab. It's called paying for more insurance for the uninsured. And to my mind, that isn't reform. That just keeps escalating the costs. Because as they go up, the premiums go up. And as the costs go up, the premiums go up. It's just like a ladder. A couple of years ago, it was $1 trillion a year in the United States for healthcare. Now we're up to $2 trillion. This industry is growing rapidly. It's one of the highest growth industries, even in this downward economy that we're facing. And all of us realize that we're having to pay out of our own pockets. If we have health insurance, there's deductibles, there's co-pays. You may or may not ever get around to actually seeing any of those premiums back in the form of reimbursements. Hopefully you do. Hopefully you never get that sick. But the problem is, how do we take care of ourselves in the first place? So you're going to see 12 specific ideas that have put together here to look at how, first of all, to take care of ourselves. Preventive health care has got to be tops on everybody's list. You're going to have a lot of good information from Ron and Jane this evening about how to do that. One of the things we can do in our schools, and since I'm running for the state school board, I want to make sure that we're clear that we can do things in our own classrooms with health and exercise. Put PE back in the schools would be one. Make sure that the school lunches are balanced diet for 2. Take the snacks out of the snack machine that are pop and Cheetos and Twinkies, things like that. Put healthy fruit and vegetables. How about some fruit drink that would go into that vending machine? Something that would allow the kid to actually get some nutrition without contaminating their body. So all these are major issues of how we can deal with things before we ever get sick. For the employers, many times we talk about making a smoke-free environment. I think that's a very good idea. The employers, of course, are paying for a lot of folks' downtime. If they're sick or injured on the job, that's a big problem. That's a problem for the employer who has to bring in part-time help to fill that void. If they kept their employees healthy to start with, they wouldn't have those lost times and low productivity. Now, the next issue I want to talk about was how to increase the supply of physicians. We've all been talking about this issue of gas prices, right? They say it's a market economy. Yeah, thank you, Dorothy. It's ha-ha. Sure it is. There's manipulation of the market by a number of different groups, and I think we can talk about that as a separate issue. But right now, the AMA, American Medical Association, does a really good job of keeping the number of physicians about the same as it was 30 years ago. As people die or retire, we have some more students come in the front end. So that process of bringing new medical students through the system to be trained is about equal to the number of folks that are leaving the medical profession. Now, what that does is drive up prices. It makes it very simple that if you have a limited supply of physicians, you've got to pay for whatever person you can see at the time you're sick or injured. Now, that's pretty nice. Any other industry, that would be called price fixing. Any other industry would say, wait a minute, we as taxpayers are paying the bill to educate the physicians. Why are we sitting here now begging them to take care of us? In Kansas, let's take an example. You have about 750 students at KU Med Center. They get as much money at KU Med Center as 4 of our region's institutions. That's Pittsburgh State, Wichita State, Emporia State, and Fort Hays. Those 4 get less total dollars from the state of Kansas than KU Med Center. That medical school is able to put in a class in the fall and a class in the spring. They don't, but they could. We have more applicants of students coming out of our high schools and colleges applying for medical school that never get in. Now, consequently, what happens is you have people from overseas. A fourth of the physicians practicing in the United States are from other countries. They're filling up part of that void. I said part, not all. Now in Kansas, we spend all that money, about $270 million, to put a figure to it, a year, on KU Med Center. Only 50% of those students that graduate with an MD stay in the state of Kansas to practice medicine. And most of them are going on into what's called tertiary care, specialized care. So it's a big problem. And by just simply saying through the legislative process, hey, we're going to have a fall class and a spring class, we have a chance to double the number of students that graduate as MDs. Then if 50% of them stay, you've increased by that amount here in the state of Kansas almost overnight. It'll take 4 or 5, 8, 10 years sometimes for that process to take place. It isn't something that you can just turn on the tap. Reason being, it's 4 years of medical school, and then you've got residency, and you've got to get started in practice. But it's something we've got to start and can. Next thing would be to apply for a process that allows the RNs, the physician assistants, to offer to us as patients primary health care.